This is Dr. Macaulay. I wanted to give a little intro on this discussion that we're going to have tomorrow on the 21st of August at Metabolic Health Conference, which is a conference conducted by Mr. Shashikant Iyengar, who I know from 2015 has been working on metabolic improvement of his personal health and also has been working in the Indian scenario with the Indian delivery of dietary approaches that through a personal journey, he has personally achieved some significant improvement in himself. But it was around 2015 also that I went through my own personal metabolic change and improvement process that I had to go through. And since then on, I was able to deliver some improvement for my patients too. And tomorrow, that is, I'm recording this early so that I can discuss a little bit in detail as to the demographics of what happens with diabetic foot ulcers and the problems that are there. But there will be a question and answer session tomorrow. And before that, I just thought I should record so that we have an idea as to what we're going to discuss. The tomorrow's conference is on healing from within, a metabolic health, wound healing, and limb preservation approach that I see as a vision. In 1990, when I planned to come over to US, one of the reasons that I left was to figure out diabetic limb salvage for India. And towards that end, I decided to move out of India to come to US to try to figure this exact issue. And luck has it that the path of healthcare that I chose with infectious disease wound care and obesity medicine happens to be the route that I'm blessed to be able to help my patients. And also towards that end, I had been part of a society called Indian Podiatry Association, which I'm a vice president of, even though I'm in USA, and a team of 5,000 doctors. We were able to bring together and try to teach wound care from a podiatry standpoint, but also will continue to improve the metabolic health aspect for India. And my goal is to work on removing barriers to healing and amputation prevention in US and India and global scale of care delivery model. Towards that end, I'm going to talk to Shashikant Iyengar, who's going to conduct this question and answer conference tomorrow. And in preparation for that, I'm going to quickly present some demographic data so that I possibly might not have time for this. So thank you for listening to that introduction. The problem majorly is India is becoming an epicenter for diabetes epidemic. Almost 90 million Indians have it. That is 1 in 7 global people have this problem. That is from International Diabetes Federation Atlas that came out recently, and 43% remain undiagnosed. That is nearly around 39 million people don't know, and 157 million people are projected to have diabetes by 2050. And this projection that is globally, this is going to be a huge problem with increasing the prevalence. And India being almost 80% of the Southeast Asia population that's going to be diabetic, and related complication is absolute tsunami. And with the urgent need is to learn and identify and improve this diabetes outcome. And together, with the help of Indian Podiatry Association and different other associations in India, my hope is to target and create a preventable amputation-free India by 2047. And I'm so grateful that Indian Podiatry Association has been a part of this journey. So we don't know much of what's going on in India with the diabetic foot ulcer. This is one study that was done. This varies with each population. Reported diabetic prevalence could be somewhere between diabetic foot ulcer prevalence could be somewhere between 3.6 to 10%, but also lifetime risk is around 25% with 90 million people living with diabetes. Now, the problem is that it is not about the epidemiological noise we have. It is how much we need to expose this need for better national surveillance, we do not have any diabetic correct data, correct standards followed and process followed. And so we need to figure that out. The hidden risk factors from another study that was done in Chennai. It is a single center study. 32% of the participants with diabetes had active diabetic foot ulcer, and 31% had peripheral vascular disease, 25% had neuropathy, and 79% did not have a good shoe. They were even walking barefoot at home, which is not a good thing because of not able to feel the sensation in the feet. So we need to figure out how many risk feet are walking around in India, and today we don't know how is that risk. So there's another study that recently was done and published in 2024 in BMJ. It was Save the Feet walking campaign in India. And in this study, they found that 1 in 4 people with diabetes in India have high risk foot, 20% have history of ulcers, 15.3% had amputation, 24.5% had deformities, and 26.4% had reduced pulses. And the message that we need to understand is all these complications, ulcers, amputations, and deformities, is that early detection saves lives and limbs. And foot screening should be a standard along with eye and kidney checks. And at every primary doctor's office visit, where a 3-minute check could be done, and offloading and education footwear could be provided. Now, the major discussion, I hope tomorrow, that is when I'm going to talk at this online conference, is for us to understand outside in and inside out. That is, when a person comes, and mostly in wound clinics, it is outside in, a hole in a person. And whereas we do something called as debridement, that is removing the dead devitalized tissue and controlling the source of infection, treating moisture, understanding the pressure, and redistributing the pressure, offloading, and then trying to get a vascular supply to the legs, because vascular supply services are very, I should say, not easily available in India. And we need to then figure out how infection diagnosis can happen, when what treatments are needed to be done. But what is, even though this is done, the outcomes are not the greatest if we don't fix inside out. So people can have glycemic variability. Glucose is one thing, but that is one major issue. But the other major issue is something called as insulin resistance and metabolic health, which is a very nuanced discussion that involves metabolism. That is more than just nutrition but also we have to understand whether people are having adequate protein. What are the other common organs involved? Cardiac, renal, vascular. What are the other issues with smoking, medications, sleep activity, and also behavior of the patient, whether they understand the risk of this problem, and how is the access to the care, how much do they have to travel, and what are the self-understanding and efficiency and efficacy of that care delivery model. From we need to figure out that the 1 in 4 people have diabetes, yeah, but we need to figure out how to screen and create a platform-based approach to deliver this solution, and high-touch wound care healing aspects and metabolic optimization. And majorly, we have to understand the policy and delivery aspect that could be created at a governmental level. Now, preventable amputation for India requires a measurement and early intervention, where we need to find whether the patient has diabetes, first of all, whether they have neuropathy and peripheral artery disease, whether it is a high-risk foot, protect that foot through education, footwear, pressure offloading, and surveillance, and also connect the patient, right professional, right time, and heal the patient from inside out through metabolic optimization, but also outside in, trying to get the patient to the right place quickly, and create a registry process, which is very much lacking, and understanding the Indian genetics and Indian food and metabolic health and nutritional environment, and also healing that has to be coordinated, the recurrence prevented, vascularization and done, and revascularization done, amputation prevented, and mortality. Towards this end, what I have been working on since a long time is creating this platform-based approach to the patient care, wherein we can have remote patient monitoring, wound management, metabolic wellness and nutrition, and AI-based automation, prediction, risk stratification, and electronic health record. And we are able to do that in US, and I would hope that we can get that done in India through coordination with different organizations and also hopefully governmental involvement down the road. So the idea is simple: empower the patient to improve them, and through the communication, personalization, realization, implementation, and reevaluation. And that is what we have to do. And this is a crisis. And the problem in India is the diabetes foot ulcer don't just take the feet, it takes the futures. In India, diabetic feet is when there is amputation, there is loss of livelihood, there is loss of independence, there is loss of dignity. And this problem affecting 1 in 4 diabetics is a huge issue. And preventable amputation free India is a goal that is laudable, but also we need team, technology, and tenacity. That means team that is able to early screen, involve multidisciplinary care, empower the patient, create that platform-based tracking, and also create that long-term remission and metabolic optimization. And I want to see us create zero amputation lighthouse centers where we can collaborate, create protocols, and continually improve, learn from the protocols, and create a policy and advocacy, and share this understanding through a process of amputation prevention and removing barriers to healing. We need to save lives, save limbs through, and that will lead to save lives through early detection. Now, my hope is only one thing. My hope is where we can take care of this complex problem by empowering and creating this platform-based approach where we are able to create this knowledge network, and we have to be the change we wish to see. And without data, we cannot do it. It can be one person's opinion, because mass medicine mindset where you take multiple people's data but does not work for one person is not the right way. So the idea is we need to prevent this bad system that will beat every good person every time through fragmented care, reactionary process, lack of data integration. Whereas we can overcome this through a good system that will uplift every human and who wants to help themselves. And obviously, in patients who have a foot ulcer, want to prevent amputation. So we need to create a platform-based approach, a national and regional data, empowered patients through communication, personalization, realization, implementation, reevaluation, and create this process where people, process, and technology can be brought together for precision at scale through better outcomes and greater efficiency and equity of care and sustainable design through a coordinated approach where we can empower every person to improve. And towards this end, I do want to create this process where we can work together and continue to create this whole approach where we can be part of a greater team for a greater solution to prevent the tsunami of diabetic foot ulceration and amputation and lives that are lost. Thank you very much. Hopefully we'll have a greater question and answer session, and that will be something that I hope to address in the Metabolic Health Conference on the 21st of August, 2026. Thank you.